Thanks for providing this letter from your doctor, Elaine. It's good to have a really thorough history for you so that we know that we're doing the best we can for you. And from what you've answered in these questions and from your letter from your doctor, who was very keen for you to continue your exercise, it just seems that you've had a problem with your blood pressure in the past.
Yes.
Okay.
Hard.
So with regard to your blood pressure, we just have to be cautious with that when we're training, because we don't want to exacerbate that high blood pressure. So we don't want you to be straining too much in any way. We don't want you to be holding your breath and bearing down. It's good that you can just keep your breath nice and even and rhythmic when you're doing all your exercise. Another thing that we're going to try to avoid is any strong overarm lifting, because that's also going to increase your blood pressure, and nothing that's going to have your head down sustained for any length of time, because we don't want all that blood rushing to your head, also increasing your blood pressure. So we just have to be mindful of that. I've checked your blood pressure and today it's good. It's only 130 on 80, so we're good to go with that. The other thing that's going to affect you and your exercise is the fact that you have your permanent pacemaker and you take beta blockers. So we have to be mindful of that, because your heart is not going to be responding as we would normally anticipate for someone not taking that medication and not having a pacemaker. We would normally use a system of your percentage of maximal heart rate, and I'm just going to talk to the camera for a moment. So with maximum heart rate and developing a system for knowing that you're in the correct target zone for your training, we would normally subtract the age, which in Elaine's case is 80, from 220, which would give us 140 beats per minute. And from there we go for a 60 to 80% range in target heart rate, which would, as figured out before, is 84 to 112. But in Elaine's case it's going to be a little different. So Elaine, we're going to be treating you in a different manner, and it's called the Ball Scale of Rate of Perceived Exertion. And it's a scale that's from 0 to 20. 20 being the absolute maximum effort, and that is what we do not want you to have. We want you to be around the 10 to 12 mark, where you feel that you are working, but you're still able to hold a conversation with me. So your heart rate is going to increase somewhat, your breathing rate is going to increase, but not so much that you're not going to be able to talk to me. As well, you might feel a little bit warmer, might have a little bit of a glow about you. So they're the things that we need to be cautious of. And with your goals, you're keen to just lose a little weight and just to feel a little stronger, so that you can be a bit more active and a bit more capable with regard to your mosaicing and things. So we'll aim to build a little body strength and just increase the cardiovascular work a little. And starting easy, and we can always build on that. But start nice and simple first and then move on. Do you understand what I've explained to you?
Yes.
And is there any questions at all?
How often would I have to go to the gym or do these things?
Ideally, to see improvement, it's really good to be working out about 5 times a week. 3 to 5 times a week is ideal. And perhaps if you could maybe come to the gym 3 times a week, something like that to start with, but be doing some sort of other activity at home. Maybe if you can go for a walk, or still using your treadmill at home, or out in the sunshine, yoga class, whatever else it is that you'd like to do, just so that you're being active. But maybe if you can aim for 3 times a week in the gym.
Sure. And do I meet up with you again, or do I just go to the gym? Or?
Yes. We'll try to set another session aside just to do another formal assessment for you in about 4 weeks' time. But of course, there's always going to be someone in the gym. If I'm not here, please feel free just to ask anyone else in the gym if you've forgotten how to use any equipment, or if you want to just have some sort of alternative exercise for the day, that's absolutely fine. Because we'll have your program all set for you, and that can be sort of referred to, and we can make the changes with regard to that. But ideally 4 weeks, and we'll keep it simple to start with, and then sort of progress and add on from there. So are you ready to start? Okay. Well, with every exercise session, it's super important that we do a proper warm-up. And the warming up is just nice and gentle. We just want to start to increase slightly your heart rate and your respiratory rate, to warm the body, to warm your muscles, so that they're nice and perhaps a little more elastic, just to get the fluid in your joints moving so that you're going to feel comfortable, and in fact, importantly, you're at much less risk of injury throughout the rest of the workout. It's also good for your mind too, not just your body, just so that your mind sort of switches on a little more, so that you're more attuned to what you're about to do.
Good.
Alrighty, so we'll head into the gym and get started.
Okay.
You ready?
Yes.
Follow me.